Hi there, HLOKC members. I'm Tenessa Pinkerton, nurse practitioner with SSM Health St. Anthony's. And I want to welcome you back for part 2 of my presentation, Skin Health and Awareness for Summer and Beyond. Basic discussion points for this presentation are going to include skin cancer facts and statistics, basically a recap from part 1. We'll go over, again, a recap of the basic prevention, but this time we're going to go over and focus more on screenings. Specifically, I'm going to go over skin self-exams, including what to look for, what you'll need, and how to perform them. We'll also be covering different types of skin cancer a little bit more in depth, also some precancerous lesions. We'll go over the overview of each, some risk factors, and warning signs, and then of course what you can do to help prevent those as well. The ones that we're going to cover today are going to be actinic keratosis, also known as AK, basal cell carcinoma, squamous cell carcinoma, melanoma, and Merkel cell carcinoma. And then finally, just go over how I can help you as a nurse practitioner and resource to you here at the center. So basically, when you define skin cancer, it is damaged cells that mutate due to that damage, and then they tend to grow out of control. Specifically, of course, we're going to talk about the outer layer of the skin, the epidermis. You usually see these cancers. It's not something way down deep inside. There are 2 causes of skin cancer. That's UV rays from the sun and UV rays from indoor tanning or tanning beds. The 4 main types of skin cancers include basal cell, squamous cell, melanoma, and Merkel cell. And those are the main typical types. Those are the ones that we commonly diagnose and really need to watch out for. Common precancerous lesion includes actinic keratosis, also called AK. If you remember from the previous talk that I gave, 1 out of 5 Americans will develop some form of skin cancer by age 70, and over 9,500 people in the U.S. are diagnosed with skin cancer every single day, and it claims the lives of at least 2 people or more every single hour. The most common cancer, both worldwide and in the U.S., is of course skin cancer. Recap from last time, sun protection. Remember, we want to seek the shade at peak UV times. That's between 10 and 4. Don't utilize indoor tanning beds. They're just bad news. They simply just put you at much higher risk, and they're really not of much benefit. Occasionally a dermatologist will use indoor UV light for treatment of certain skin disorders, but it's far and few between, and they do it with great care and consideration before utilizing those methods. Definitely want to avoid sunburns. Remember, 5 sunburns or more increases your risk of melanoma by 50%. That's pretty significant. We want to say cover up. That includes clothes, sunglasses, and don't forget the wide-brimmed hat, at least 3 inches around to kind of cover and give shade to your ears and neck and shoulders. Also the sunscreen. We want SPF of 15 or greater for daily use, and 30 or greater if you're going to be outdoors for extended periods of time. Some people may need a higher SPF. Remember, those are the people who may either due to medications or skin sensitivities, you may need more. Also, some of those who are immunosuppressed, like with lupus, those people tend to be a little bit more sun sensitive. Self-exams of your skin, those need to be done monthly, and we say head to toe, and we really do mean head to toe, including the scalp area, and in between the fingers, in between your fingers, in between your toes, all over the place. So it's a time to really get to know your skin, get to know what's there, what's normal, and know that when you look and something's different, that you can be able to detect that. It's great, and we always definitely recommend that you go and see a dermatologist at least annually for a good, thorough skin exam. Again, that's only yearly, and a lot can happen in a year, and some of these skin cancers and precancerous lesions can change quickly. So again, the importance of doing at least monthly self-skin exams, and then definitely getting in touch with a dermatologist, getting established with one that you trust, and have a good relationship with. And that way, you know, on annual, if you see something between your annual visits, you can call them and say, hey, look, I've got something that just doesn't look right to me. You can also mention that to your primary care provider and let them know that you found something different, and they can, of course, sometimes expedite your visit to a dermatologist if needed. Skin self-exams. The good news about skin cancer is that they actually have a really high cure rate when they're detected early. So again, that's why we say do those skin self-exams. We need to do these monthly, and you do want to do head to toe. There are some times in which, you know, it may not be easy to do head to toe with, and when I kind of get to those areas, we'll talk a little bit more about that, and about how in that instance it may be that you follow up with your primary care provider. If you go and see them every 3 months, you may say, hey, listen, I know I'm coming in to get my meds refilled, but can I add one more problem on there? I just want you to look at my skin and make sure that nothing has changed. Or even every 6 months would be feasible for that. Or you know, when you go in and say, hey, look, I do my regular or skin checks, and I haven't found anything, but I have a hard time seeing, you know, my lower back or an under part of my leg, or maybe perhaps you can't see the soles of your feet. I know definitely, even when I was pregnant, that was literally almost impossible. And the older I get, the harder it is for me to bend over and look at things anymore. So can totally understand that. And as your primary care provider, we want to help you with that if we can. What you'll need, basically you need a bright light. That can be the flashlight on your phone, a bright flashlight otherwise, but an extra bright light. You do want to be in a well-lit area with good natural light if possible, but definitely want an extra bright light so that you can shine on areas that maybe might not be well lit, even in a well lit area. You do want a hand mirror, a full-length mirror, and 1 or 2 chairs or a stool, a blow dryer, and paper and pencil. So what to look for? Basically, warning signs of basal cell, squamous cell, melanoma, Merkel cell, carcinomas, any of those, you want to look for any of the warning signs, and we'll discuss those in detail. Big thing to look for is something new and different. Something new and different that doesn't look right. If you know, we have the saying, when in doubt, check it out. So seriously, if you see something that concerns you, you want to get it checked out. Okay, so what to look for when you're doing self-skin exams. Basically, you're going to want to look for the warning signs of basal cell, squamous cell, melanoma, Merkel cell carcinomas. We'll talk about all of the warning signs of those in detail later, but basically, and most importantly, you're looking for anything that is new, that is changing, anything that's unusual. We have this saying, when in doubt, check it out. So if you see something that concerns you, you want to take note of that, and definitely have your primary care or your dermatologist check it out, okay? Other things to look for, besides anything new or unusual or changes in your moles or growths, anything that's different, you're going to look for sores that that continue to itch, scab, or bleed, and any open sores that don't heal, especially within about a 3-week time period. Sometimes those sores will start, they appear like they're starting to heal, and then they'll regress and they'll go back. And so we always say any unhealing wound is usually skin cancer until proven otherwise. It's just, you know, definitely something that we always take a good alert to, and want to make sure that we're not missing something. So in order to perform your own self-skin exam, you know, starting with your mirror, the first thing that you're going to start with, we say head to toe. It's a good thing to start with the top and go to the bottom. You can start from the bottom and go up if that helps you, whichever one is easiest for you, but generally we start from the top and go down. So you're going to start with your face. You know, pay close attention specifically to your nose, to your lips, to your ears, and, you know, to your mouth. I also have people, again, a good reason for that flashlight, you want to look inside your mouth, because there are actually a few different types of skin cancers that can actually be inside your mouth as well. When you have the mirror, you want to, you know, especially when we talk about the ears, you want to look at the back of your ears. I'm going to pretend like this is my mirror, and like that this window back behind me is a mirror as well. So you're going to hold it up and you're looking much like you would look at the back of your hair or anything else, just to get, you know, a glance of the back side of you on this side of the mirror. Next, you're going to inspect your scalp. This is where you would use the blow dryer. Some of us are unfortunately lucky enough to have thinning hair like me, and so it's not too hard to see in between, but you're going to take that blow dryer and, you know, fold over sections and really kind of look in your scalp. You'd actually be really surprised at the amount of skin cancers that we find on scalps, because all too often we didn't wear a hat or protection on our head early on, and it can certainly still, you know, it's ultraviolet rays, so it still goes through that. Gentlemen, if you are bald, this makes it really easy for you, but you do definitely want to use that mirror, get all sides, look behind the ears, on top of the ears, you know, thoroughly throughout your scalp, even the base. You're looking at your neck, and then, you know, kind of you're gonna go down next to your hands is where we usually go. That includes the palms of your hands, so palmar area of your hands, between your fingers, your wrists and forearms, and you definitely, oddly enough, want to check underneath your fingernails. There's a specific type of melanoma that we'll get to later that does present underneath a fingernail. So this is a time that if maybe before you go to get your nails done once a month or every couple of weeks, at least one time before you go do that, take the polish completely off so that you can see the beds of your nails, okay? Then we want to do, okay, so then we're gonna scan our arms. And again, you're going to take that mirror and you're going to be looking, I mean, you can see in front on your own, but to see the back, you may need that mirror to kind of look behind you and see what, scan your arms from that area. After you've done all sides of your arms, even your upper arms, make sure that you raise up. You want to check the armpits as well. Then you're going to move down to your torso or trunk area, so that's going to be the full upper part of your body, front and back. Make sure and look on your neck and your chest area. For ladies and even some gentlemen, you may have to lift some breast tissue up to make sure that you scan and look under there as well. Generally, most skin cancers, again, come from UV exposure, but it doesn't necessarily mean that all of them have to be in commonly exposed areas. So definitely want to check underneath folds, okay? Let's see. And after you've gone to the upper part of your body and upper back and looked at everything, again, using that mirror to look front, back, side. If you can't see it in the mirror, you know, then you're going to use that mirror to kind of reflect. Now, something that I'm doing now as I'm doing this video, if you have a smartphone, that's not a bad idea. If you find something, granted you don't want it to be a graphic area, but if you find something maybe on the back of your arm, you could actually kind of do a screenshot of it and say, hey, look, there's this spot right here, and kind of remind you on the next time that you go to your physician, or even remind you to make an appointment to get that looked at. Also, once you've done, your lower back and you're already turned around, you want to go ahead and scan the backs of your legs as well. Make sure you didn't miss anything there. And then when you inspect your legs, when I said to use a chair or a footstool earlier, you kind of alternate legs. You put one leg up and look really thoroughly. You can use that mirror again to kind of go underneath and look and see. There is a specific skin cancer that is related to HPV, and it can actually cause some lesions on the genitalia. So again, this is a full body, head to toe exam. So you want to look in your genital areas and make sure that there's not any new moles, growths, anything else that's popped up. And last but not least, again, don't forget to look at the soles of your feet and your toenails without the nail polish, okay? We do that once a month, again, head to toe, and if you see anything unusual or abnormal, that's what your pencil and paper is for. New lesion, right upper arm, you could write down, or new spot, left lower leg, below my knee. Again, when we talked about just a few minutes ago of utilizing your smartphones, if that's helpful for you, you could take a quick screenshot of that. We're going to try to go ahead and move on through actinic keratosis. That's the most common precancerous lesion. It's caused, of course, by chronic exposure to UV rays from either indoor or outdoor tanning. It often presents as like a small, dry, scaly, or crusty patches of skin. It can be kind of a variation of colors. Sometimes it's raised. In fact, we actually say it's easier to feel than it is to see. Most usually on common sun-exposed areas, that's the face, lips, scalp, ears, neck, backs of hands, and forearms. Risk factors for actinic keratosis include chronic exposure to UV rays, so lots of outdoor time, development of one actually increases your risk to develop more. So it's like once you have one, you're more likely to have more and more develop. Again, this damage is caused over time, so it's not like it just suddenly causes something new to pop up. This has been damage that's been over time for years and years and years. So you may find one and then find another and another and another. So it's just, good to be on the lookout for that. You may actually transform into squamous cell carcinoma, which is and possibly an invasive form of or squamous cell carcinoma. So you definitely want to be on the lookout for these. Warning signs, again, usually a flat or slightly raised texture, scaly and crusty, but usually very rough to the feel. They can be red, tan, pink, flesh-colored, brown, or silvery. They vary in size, anywhere from just a tiny little dry spot to anything over an inch in diameter. I've seen those. They are usually in sun-exposed areas, again, and the only other place is actinic cheilitis, which is actually found usually on the lower lip. Again, kind of a crusty, hard, scaly, almost a sore. Should definitely be something to look at. Over 58 million Americans have at least one AK, and although 5 to 10%, only 5 to 10% actually turn into cancer, the vast majority of those squamous cell cancers started as an AK. Prevention and screening, basically, again, those monthly self-checks are extremely important, as well as yearly visits to the dermatologist and practicing your sun-safe habits. Basal cell carcinoma. This is the most common and most frequently occurring of all skin cancers. This is not precancerous lesion anymore. This is an actual skin cancer. Over 4 million Americans are diagnosed every year. Again, primarily caused by UV rays from the sun or indoor tanning. These guys are usually slow growing and have a pretty high cure rate with minimal damage if you catch them early. Excess risk factors for basal cell includes, of course, the excessive UV ray exposure, a history of skin cancer. Again, like we said earlier with the AKs, once you develop a basal cell carcinoma, your risk for developing more in the same area actually increases. Another risk factor is age 50 and above. Again, think about accumulation of sun exposure and damage over time. Fair skin. These are typically your red or blonde or redheaded or blonde-haired, blue-eyed, gray-eyed, fair-skinned, lots of freckles, burns easy. That's fair-skinned folks. If you're not really 100% sure if you're fair-skinned or not, there are a lot of people that say, oh, you know, I have light hair and light eyes, but I never burn. You know, it's a good idea to have a good knowledge base of what your skin type actually is. And there is an actual skin type quiz on the Skin Cancer Foundation website. And I highly encourage you to go to the website and take that quiz so that you're pretty sure on what type of skin type you do have. Basal cell does actually affect men more than women, but ladies, we are catching up fast in the statistics, so it doesn't negate us by any means. Other things that put you at risk for it are skin injuries, chronic inflammation or infection. It's rare, but it's been linked to repetitive exposures to other radiation forms, chemicals, again, chronic inflammatory skin issues, and complications from burns or scars or infections. Warning signs. Again, it's those open sores that don't seem to heal, or maybe they appear to heal, but then they come back. These are, again, the reddish patch or an irritated area that might crust or itch mildly, but usually not painful. If it is, it's pretty mild, or it could be completely painless. It's just a new area of skin that you're like, gosh, it wasn't there, you know, a few months ago, or it like slowly has crept up. Also can be a shiny nodule or bump, usually either clear or pearly in appearance. It can be in shades of pink, red, or white on light skin, and then on darker skin, it's usually tan, black, or brown. It's often mistaken for a mole. These look pretty, when we get into the ABCDEs of melanoma, these guys usually have pretty decent borders. They look, you know, sometimes like some people have beauty marks, and sometimes these guys can resemble that, but they're not. A big difference that you'll notice is that where beauty marks you may have had since you were 5 years old, this one, you know, you suddenly are 55 and you notice, you're like, gosh, that wasn't there a year ago. These guys take a while to grow, but they, you know, certainly they look benign, but they're not. Prevention and screening. One more other thing. These can also present like a scar where it's really flat and waxy almost. It can have kind of a yellow tinge to it, but generally it's really light and almost waxy, like you've got a scar, but you don't remember actually doing anything to receive that scar. And those are the ones, the scar-like appearance of basal cells, those are the ones that usually have asymmetrical borders, so their borders will be uneven and poorly defined. Prevention and screening, again, when in doubt, get it checked out. Keep up with your routine screenings and see your dermatologist and your PCP. The self-check or self-checks done monthly from head to toe. and sometimes a little bit more frequently. If you develop one of these, your PCP or your dermatologist may say, hey, I want you to do these skin checks, monthly, or even every, do your skin checks monthly, but I want to see you, every 3 months or every 6 months, whatever the case may be. And then 100% daily sun protection is absolutely key in prevention. It doesn't necessarily reverse the damage that you've done previously, but it certainly keeps the damage or any future damage from occurring. Squamous cell carcinoma, it's the second most common type of skin cancer. It's also known as a cutaneous squamous cell carcinoma. We say cutaneous because it refers specifically to the skin. Squamous cell can also be found in lung tissue and other areas. But this one in particular is cutaneous squamous cell, so skin squamous cell carcinoma. Most of these are curable if they're caught early. 15,000 Americans die yearly from squamous cell carcinomas. Generally, again, they're pretty easy to treat and highly curable, but you do need to find them early and keep an eye out for them because they can become invasive and deadly. Warning signs in particular, these are usually on common sun exposed skin areas, so you're going to see these types of things pop up again in the face, shoulders, forearms, backs of the hands, anything that's commonly exposed to the sun or was exposed to the sun. These are usually thick, rough, scaly patches. Sometimes they can appear almost wart-like, can kind of grow up into almost, I've seen some on the ears that look like, we call them horns. They look like ear horns. Those can happen. They may crust or bleed, and again, the non-healing sore. If it's not healing, you want to suspect skin cancer until it's proven otherwise. Growths that have raised borders and a lower area in the center. I wish I had a really good picture that I could share on this video with you, but those are the ones that look like I've seen some on the lips, that it's almost like an indentation, and they're usually, although they're rough in texture, it kind of almost looks smooth, but it's like an indentation, and it has the raised borders. But the center of it is lower. It's usually not smooth to the touch, but it can kind of, the texture of it appears different. Also, this website, the Skin Cancer Foundation website, has amazing pictures and examples on it. Highly, highly recommend that you do make a visit to that website when you have a chance, just to view the examples even, so that you can kind of be a little bit more familiar with what you're looking for. Risk factors for squamous cell, again, UV ray exposure. In fact, almost 90% of the squamous cell carcinomas are a direct result of UV exposure. Interesting fact, if you tanned in an indoor tanning bed at any time in your life and history, you have a 67% increased risk of developing a squamous cell carcinoma. 67%, so that's more than half. If you used an indoor tanning bed, the likelihood of you developing one of these types of skin cancer is pretty high. Unfortunately, that's going to be me. So before I knew a whole lot about it, and actually I think even before medicine really understood indoor tanning, that was kind of something that was highly sought after. Now we know better, so hopefully we can avoid those. Other risk factors, a weakened immune system, and by that I mean someone who may have HIV or be receiving chemo. It just makes your skin, your skin is an organ, so if you're immunosuppressed, it's not going to function quite as well either. So its ability to defend itself in sun and UV exposure is going to be decreased as well. So again, HIV, cancer chemo treatments, those tend to make you more susceptible to development of things like this as well. History of skin cancer is just like anything else. If you have one, you're at risk for having multiples. Once you have one squamous cell, you need to be on the lookout that maybe perhaps these might develop a little bit more frequently. Again, age over 50, fair skin, gender, males or gentlemen, you're at more risk than a female. Sun-sensitive conditions, specific xeroderma pigmentosum, that's a pretty rare genetic disorder. In fact, the life expectancy is only about 30 years of age, so not super common in this age group. But it is, definitely a sun-sensitive condition. Another one might be albinos or albinism, high, just a higher risk for sunburn, for limited exposure to the sun if you're at a high risk for sunburns. Chronic skin inflammation from burns, scars, infections, or other conditions like we talked about. Basically, you want to think about repeated injury or repeated damage to these skin cells. That's what's going to cause the mutation in them and cause them to grow out of control abnormally. Skin precancers, much like the AKs. If you have AKs, again, remember we said that although only 5 to 10% of those AKs grow into us, or AKs become a skin cancer, when you look at the squamous cell, most of the squamous cell in particular developed as an AK first. Also, this is the one that I mentioned earlier when you were doing your self-screenings, history of HPV, that's human papillomavirus. It is considered a sexually transmitted disease or virus, sexually transmitted infection. Even though the virus may clear your system and you do fine, it increases your risk of developing squamous cell, especially in the genital area. Prevention and screening is the same as previous, protection from the sun, your monthly skin self-exams, and follow up with PCP and dermatology. Now we're going to skip over to melanoma. This is a big one. This is probably one of the most serious forms of skin cancer. It is less common, but unfortunately this type of skin cancer spreads very quickly to other organs. It's caused by mutations in melanocytes, resulting in an abnormal cell growth. Again, it's that damage to in this case, melanocytes, not skin cells, but melanocytes that makes them reproduce and grow abnormally. Interesting thing about melanoma, although we tell you to look for changes in colors, in moles, shapes and sizes, things like that, only about 20 to 30% of moles actually turn into a melanoma. Again, want to watch them carefully for that, but usually about only 20 to 30% of them actually turn into a melanoma. Melanomas usually occur on normal skin areas. They just kind of pop up and you're like, whoa, what was that? I've not seen anything like that before. About 70 to 80% is occurring on the skin, not just moles turning into it. Fair skin, again, is at most at risk, but dark skin can develop some pretty serious types of melanoma as well. Specifically acryl lentiginous melanoma, and that one is found on the soles of the feet, the palms, and on your nails, underneath the nail beds. Interesting fact, that is actually what killed Bob Marley. He actually passed away from the acryl lentiginous melanoma, and that spread to other organs of his body. Estimated usually about it says 6,850 people will die from this in the U.S. this year alone. Okay, so the 4 different types of melanoma include superficial, Latigo Malignant, acryl lentiginous, and nodule. For superficial melanoma, that's pretty much the most common type. It can, be from, it can occur in an existing mole, so that's why you want to watch for anything that's new or unusual, but most commonly it just appears on normal skin. It's something new that pops up. It does affect men and women a little bit differently. The most common site for this to show up on women is on your legs, and fellas, it's on your torso or your trunk area. Equally, for both men and women, it's found on the upper back, so back here. It's usually flat or slightly raised. It's discolored. It has irregular borders. It just looks, we call it the ugly duckling. It just doesn't look like any other normal mole or skin spot. It definitely usually gets your attention. It can have a variation of colors, including all shades of tan, brown, black, red, pink, blue, actually, or even white. There are a few different types that lack pigmentation altogether, so they can be skin toned or a light pink. Those aren't really common, but they're certainly there. So definitely, just want to be on the lookout for something that's just not normal for you. Latigo Malignant, this one develops often in older individuals. Contrary to the superficial type, it does grow, close to the skin surface at first, but then it can, quickly spread beyond that site and cause some pretty bad issues. Unlike the superficial melanoma, it actually tends to pop up on the sun-damaged areas. So face, ears, arms, or upper torso is where this one is particularly found. It, again, is flat, slightly raised. It's a blotchy patch. It has uneven borders. That uneven borders, where it looks more like a floppy amoeba than a nice circle, is pretty important. You'll hear that again and again. It is usually a blue-black color, but can also be brown or dark brown. I have actually seen one of these, or I've seen several, but I have actually seen these, and they really do have that bluish-black appearance. They're pretty interesting looking. The Acryl lentiginous melanoma, it's the most common form of melanoma found in any people of color. It usually presents, for those people, it usually presents on palms and soles of feet and on your nail beds or underneath your fingernails in your nail beds. Interesting known fact, that was what I think I said earlier, Bob Marley passed away from this. Nodular melanoma is the last one that we want to kind of cover of the melanomas. That one is the most aggressive type. It accounts for 10 to 15% of all cases. It is a tumor that actually tends to grow into the skin quite a bit deeper, usually found on torso, legs, and arms, as well as scalp in the older men. It's usually invasive from the moment that it's diagnosed, so that's the big bad ugly melanoma that you don't really want to find. But again, if you're aware of any skin changes, and the quicker and more rapid that you can get a diagnosis and get treatment for it, then the better your outcomes would be. First, they do say that it's often recognized as a bump, and it has that usually black-blue color, but it can also be pink or red. So again, melanoma can be pretty tricky. Risk factors for melanoma: UV exposure, weakened immune system. One thing that's different about melanoma, we call it mini moles. The more you have, the higher the risk, of course, because moles can certainly, turn into a melanoma, but also because when you have multiple moles, sometimes it's harder for you to recognize differences when a new one pops up or something goes awry. There's also a genetic disorder it's a familial, basically that you develop multiple moles, and it's actually kind of a hereditary type genetic component. So if you know that you have that, and if you know that you have family history of that, then that actually is a risk factor as well. Skin cancer history, either a melanoma or non-melanoma. So if you've had basal cell or squamous cell, your risk for developing a melanoma has increased. Again, genetics, it says 1 out of 10 of those that are diagnosed with melanoma actually have a family history, either one family member or somebody who has it on down the line. So just kind of be aware of, if you have a family history of someone who has had melanoma, then that certainly puts you at risk. If you yourself have had melanoma, you want to make sure that your kids know that, so that they can really beef up their skin prevention and screenings, so that they can keep an eye out for it. This is the one that we said earlier, 5 or more sunburns in a lifetime more than doubles your risk to develop melanoma. And I believe it was in the previous presentation, 5 sunburns over a lifetime, or 1 blistering sunburn as a child. Or even, I guess, in a lifetime, but 1 blistering sunburn increases your risk by 50%. Warning signs, always, anything new and changing. If in doubt, get it checked out. This one can affect both exposed and non-exposed areas to the sun. That's why, again, want to look underneath the arms, in the groin area, anywhere, because again, this is the one that pops up on normal skin. It doesn't always have to be a mole. It doesn't always have to be something that developed, from the sun. It's definitely a risk factor for it, but it doesn't necessarily have to be in those exposed areas. Most commonly found on the legs for women, and trunk and torso for men, equally for men and women on your upper back. And other warning signs that we kind of want to talk about. Earlier I talked about borders and raised or not raised. We call those the ABCDEs of melanoma. And then we'll go over also, it's called the ugly duckling. So we'll get to those in a second. But you always want to be on the lookout for anything abnormal, and get your routine skin exams. Again, melanoma can be tricky. The trained eye is looking for several things, where maybe someone who's not really 100% familiar with what to look for might miss something. We give you these tools and bits of knowledge to try to help you make great informed decisions, keep an eye out, and get things taken care of early. But again, really following up, for yearly exams with your PCP and your dermatologist are going to be key in keeping you safe in that area. So the ABCDEs, that's asymmetry. Asymmetry, of course, means the jagged edge. It's or if you cut it in half in diameter and you were to fold it over, it wouldn't be equal. Border means that uneven, jagged, scalloped edge appearance. Is the one that a scrambled egg, how sometimes the scrambled egg will kind of have those the uneven edges. That's a good example of it. Color in particular, multiple colors in a lesion are concerning always. That's that multiple shades of brown or red, or maybe, gosh, there's a spot that looks almost blackish blue. Those are something to be concerned about. Diameter, D is for diameter or dark. Lesions greater than 1/4 inch in diameter, that's the equivalent of a pencil eraser or larger. So any lesions that are that size or larger are of concern. And also any lesion that's darker than others. Maybe you have a few moles here and there, but one's like really super dark compared to the other ones. So that's something that you want to keep an eye on, and possibly even get biopsied to make sure that it's not a melanoma. The E stands for evolving, and that means change in size, color, shape, elevation. If it was flat to begin with and now it's starting to get raised. Also, you know, if it starts developing any new symptoms such as bleeding, crusting, itching, again, that non-healing wound idea, anything like that is of great concern. The other way that, or the other method that we kind of look for is, it's called the ugly duckling method. So that's basically that something stands out. It's just not in the right spot. It's either a really dark mole amongst, or a really dark spot amongst other moles, or it could be a really light spot against other moles. Or simply it's just this odd, sweet little ugly duckling that's just kind of hanging out there. I do have a example of the ugly duckling chart that we use. I don't know if you can see this very well, but this is the one, the little guy that stands all alone. This one is showing you the lighter colored as compared to the other skin dots around, or skin spots around it, and this one is indicating that this one's really dark and maybe larger than the others. Okay, so that's kind of the ugly duckling method that we look at. The final skin cancer that we want to cover today is going to be Merkel cell carcinoma. I don't know how many of you all are familiar with Merkel cell carcinoma. It's pretty rare, but it is a very highly aggressive form of skin cancer. It has a high risk for recurrence and metastasizing. It is actually 3 to 5 times more deadly than melanoma is, and it's good thing is that it's 40 times more rare than melanoma. Currently in 2020, is estimated that we'll have about 3,000 new cases annually. They do expect that to increase, but not by much, only maybe a few hundred cases by the year 2025. So, and you know, again, it's rare, but it is still on the rise. Risk factors for this include sun exposure, the fair skin, age over 50, history of skin cancer, the gender factor. Men are affected more than women in this. That is something that usually, if you develop a skin cancer in an early age, it usually affects women more than men, but age 50 and older, it generally is affecting men more than women. Let's see, a weakened immune system. This particular skin cancer has an interesting correlation with that, and I'll get to that in a second. It is not hereditary. It's most likely due to one of those aspects that we just talked about, the usual risk factors, sun exposure, fair skin, etc. Most likely, you know, due to exposure over time. There is a strong link for Merkel cell skin cancer and immunosuppression. Interestingly enough, and immunosuppression in specific, HIV, lupus, rheumatoid arthritis, psoriasis, and Crohn's. Individuals with immunosuppression such as that, they may develop this prior to age 50. Again, interesting about Merkel cell carcinoma, there is a Merkel cell virus. I know, gosh, you know, with all the virus talk lately, but there is a Merkel cell virus. It was discovered in 2008. It lives on the skin of most people. It's like a common virus that just lives on your skin. Most people have no signs or symptoms. They have no issue, and they usually don't develop Merkel cell carcinoma. However, what they found is, unfortunately, perhaps maybe it's because of the immunosuppression in specific that puts them more at risk. that if they have this virus on their skin, that perhaps that's what's doing it, but they can't really, there's not been a 100% correlation of cause and effect with that as to why, if it's on so many people, if it's a common virus on everybody's skin, why does it affect some more than others? It's not always found in Merkel cell carcinoma tumors, but most of the Merkel cell carcinoma tumors do contain this Merkel cell virus. So just interesting tidbit. Warning signs of this particular skin cancer include the appearance of painless, shiny, pearly lesions or nodules. Size can vary, but the average size when it's detected is about 1.7 centimeters, which is equal to the size of a dime. That's pretty decent size. The color can be, again, variation, skin colored red, purple, or bluish red. So really turning, more towards the bluish red, purpley colors. The location, generally sun exposed areas. You're looking at your head, neck. Specifically on Merkel cell, however, they say the eyelids are affected. There's another, much like the ABCDE for melanomas, the Merkel cell has what we call AEIOU characteristics. So the vowel sounds, AEIOU. A is for asymptomatic. E is for expanding. The lesion expands and it grows rapidly. I is for immunosuppression. That's that history of immunosuppression that may put you more at risk, maybe perhaps from the Merkel cell virus that lives on your skin. Not 100% sure on that. O stands for older than 50 years. Again, this usually affects people age 50 years and older. Unless you're immunosuppressed, then you have the possibility of getting this a little bit earlier on. And then finally U, that's again UV exposed area. If the lesion is commonly exposed, it's usually on the commonly exposed area. That was a whole lot to kind of cover. I know maybe some of you who are visual people, if you would really enjoy, I highly recommend that you go to the Skin Cancer Foundation website. Every single thing that I talked about here is on that website. It has got a wealth of information for you, and I highly recommend that you give it a look at some point in time. If not to further your knowledge, at least look at the pictures of the different types of skin cancer so that you can kind of get familiar with what you're looking for. It doesn't, negate the fact that we definitely want to do the annual skin exams with a dermatologist and follow up with your primary care. But it's definitely a great resource for you to at least kind of get a little bit of knowledge to help yourself out. What can I do to help? As a nurse practitioner, I'm trained to do basic and focused skin exams. That can include anything from a primary care visit, which when I do a primary annual visit, that's a pretty extensive visit, and I look, at skin, the whole 9 yards for anything new. Also, if you happen to notice a new lesion and you're like, gosh, I'm really not sure about this, I think it looks odd, but I don't know if I need to get it looked at any further, I would be happy, to do a visit with you and see if it needs to have some further investigation, and then get you pointed in the right direction if you don't already have a dermatologist. Or, certainly can reach out and give them a shout and say, hey, look, this is something we found, it needs follow-up pretty quick. Also, I'm here to give you guys guidance on appropriate screenings and sources of information. There's a lot of information out in the world today, a lot of different sources. And if you're confused or concerned and want to know where to go and where to look, pop in anytime, and I'd be happy to give you some guidance on that. Also, as far as prevention methods, be it SPF creams or, the sunglasses, anything else that we talked about. If you want to know how to, maybe better protect yourself, I'm certainly there to help you with that as well. always happy to help. So if you haven't met me yet, again, highly encourage you, please come on by and say hi. My clinic is located inside the HLOKC Wellness Center, right next to the cafe, so hop in anytime. You'll also see me wandering out and about throughout the center. Right now masks are required, so in case you haven't seen me before, this is what I look like with my mask on. Until I see you guys again next time, and or see you here in the center, you all have a great day, stay safe, and have a wonderful summer.